Bottoms up.
In the movie Death Becomes Her, Meryl Streep's character drinks a potion, and within minutes she looks younger and perkier too. If it was only that easy to turn back the clock, we want to get serious about issues with aging. We turn to the doctor. That's Dr. Bill Johnson of Innovations Medical. He's here to help us understand what we can do to slow down, or in some cases even reverse appearance of aging in our face and also our bodies as well. Good morning, Dr. J.
Good morning.
All right, you have all of our attention. We talk about anti-aging. What approaches do you use when we talk about aging?
Well, the real trend in all of medicine over the last couple of decades has been using multiple techniques to approach a problem. We call it multimodal therapy.
Okay.
So if you've got high blood pressure, your doctor's going to tell you to lose weight, he's going to tell you to exercise, and he's going to put you on 2 to 3 medications. That's because each of those is approaching it from a different way. If you have diabetes, the same way. If you have cancer, you'll hear cancer patients get surgery, radiation, and chemotherapy with 2 or 3 drugs.
Okay.
That's because each of those takes, as a piece of the puzzle, they approach part of it from a different direction. So that's how we need to approach anti-aging. Realize that each thing does a part of the puzzle.
Okay, multi-platform we're talking. So what's the usual starting point when someone comes in for anti-aging procedures?
Well, we really like Thermage. There are a lot of tools out there that talk about doing skin aging. I was looking at the research again yesterday, and Thermage is easily the best researched and has the most data out there showing it works. So you can see some real differences in this, and this is in 2 months. So you can see that this makes a real difference over time.
I would say Thermage is what people ask me, GMT viewers, about the most because it's such an effective procedure. You could add things to that to enhance Thermage.
We really can, and Thermage is nice because we can also move off of the face and help with aging on the abdomen.
Right.
And it makes a real difference. This is an 80-year-old abdomen, and so you can make some real differences on those.
Yeah.
So one of the things we like to add to Thermage is resurfacing.
Okay.
Now, resurfacing has changed a lot. A decade ago, it was really brutal therapy, but now we use a fractional piece where instead of removing the whole surface, we remove thousands of tiny dots.
Yeah, it's come a long way.
Really has, and that makes it much less downtime and keeps the efficacy. So it does a great job with pigment, it adds to facial tightening, it does a great job with small wrinkles. So it's a great thing by itself, and it's great to add to Thermage.
Okay, and topical agents are really popular right now. I know you've got some products on that table. What do you recommend?
Well, topical agents, there's so many,
right.
And it's a huge multi-billion-dollar industry. But unfortunately, there's very little research supporting most of them. So what we look for was something with some research, and we've started using AQ products, which have human growth factors. Now, a lot of products out there with growth factors, but this is actually human growth factors, which is important because that's what we as humans respond to.
Okay.
So we can see some real differences. This is in about a month, and this is also for acne. We can make a real difference with acne.
Yeah, look at that.
In about 2 months with using human growth factors. The way this works is as we age, the growth factors secreted by our skin that has it rejuvenate decreases. We get less and less. So by applying this, we get to call in those same factors that as a young person help keep our face fresh and renewed.
Okay, and that animation really helps us kind of explain what's going on with this reaction. We saw the acne, which is really stunning, and we see the hair behind us. Another way we can grow.
It does have a hair growth product.
Yeah.
It stimulates the hair follicles with using growth factors, and you can see a real difference again. And we use this both in men and women because women also get to where their hair on their head is thinning, and it can really make a big difference there.
Dr. J, you're always here with the best innovations. Thank you so much for sharing these with us today. And the good news, you can find out more by visiting this website, innovationsmedical.com. You can also view more detailed segments about this and other segments we say here on GMT with Dr. J on the website and also on YouTube. And in Dallas, you can call for a consultation. It's 214-420-7970. And over in Fort Worth, 817-744-7904. GMT's coming right back.